Good morning, guys. Today we would like to discuss on something. How do we target more grafts in one sitting? Because most of the some people suffer from large bald area. They'll not have time to come back for second session after 6 months or later. For them, if they are looking for more grafts in one sitting, how do we handle it? How do we do? That's what I wanted to show a practical patient with us today. So kindly watch the video until end to understand how can we target more grafts without depleting donor, without damaging your donor. How can we target more grafts in one sitting? That's the topic for today. Kindly watch the video until end to understand the details. Well, most of the time, most of the people always requires more number of grafts, but at the same time, we cannot damage the donor in the back. So, because of that reason, we have always limitations in the harvestation of the grafts. When we talk about the limitations, when you talk about the scalp grafts, usually 3,500 grafts, usually limited in one day, because there are few cases we can target even 5,000 grafts also, but well, 80-90% of the patients can easily give 3,500 grafts without damaging the donor. Well, there are a few guys having a very large bald area. Imagine they need more grafts. Suppose they need more than 5,000 grafts. What can we do? Usually we do this kind of patients second session after 6 months. Well, a few guys have no time, otherwise they have time constraint where they cannot go for second session after 6 months. Suppose they want to get more density or more grafts in one sitting. So what are the options we have it? For them, usually we can do next consecutive day a graft from the beard. That means approximately we can target 3,500 or 4,000 from the scalp, around 1,500 to 2,500 from the beard next day. That means 2 consecutive days we can have a procedure done. That's they're going to get more than 5,000 to 6,000 grafts. Here we need to understand backside donor is not damaged with this. That means we are not targeting all the 5,000 grafts from the scalp. We are targeting 20 to 30% of amount of the graft from the beard, and sometimes even chest also. A beard is most feasible when compared to the chest. That greatly depends on the patient requirement and patient density in the chest and beard. So after the scalp, always beard is considered best. Next goes to the chest. This patient we did almost 5,400 grafts, approximately 5,400 grafts, where scalp we harvested first day and second day beard grafts. Usually beard grafts cannot be implanted in the hairline. We cannot implant in the swirl area also, crown area also. That means we need to combine these grafts and implant the mid scalp or frontal floor lock area, because the hairline has to be always with the scalp grafts only. Even in the scalp crown also, we cannot utilize the to create the swirl with beard grafts. That means somewhere in the mid scalp, to achieve the density, we can add the beard grafts. At times what we do is we are going to combine the scalp and beard grafts in between, so that certain area we don't have certain area we don't have only beard grafts. We can join both scalp and beard grafts such a way that we can get the distribution nicely. So that is the idea of doing 2 consecutive days. In this patient, we had a 2 day session and completely covered the area from even front to the back, including crown. Well, we need to understand one more thing. This patient now donor is still preserved. That means the backside still I have grafts to harvest next time. He can always undergo a second session after 6 months minimum gap or more than that. After 6 months also we can target again 2,500, 3,000 from the scalp itself. Right now we covered a large area with 5,400 grafts. Again we can have scalp grafts to implant everywhere. Wherever the gaps are there, we can refill it. We can reinforce the density. And that is the idea of doing second consecutive day, 2 days procedure, one sitting, 2 sessions. Okay. If you can see, this patient is completely covered from hairline to the crown. And that's the beauty of getting it done more than 5,000 grafts. So it happens in most of the patients who really want to travel, who don't have much time, or someone really don't want to come back for filling the crown or whatever the area after 6 months. If they want to get it done in next day itself, definitely we can do this, provided they have a good beard or good chest hair, that will be suitable. When we target beard grafts, our surgeon is supposed to know well about surgical anatomy, because a lot of vital structures run in the face and neck, and we are going to use very precise, very fine punches to harvest the beard, unlike scalp. Most of the guys will fear about would I get any scars in the face. I think you should not worry about any scars in the face, because the finer instruments are available today and more precise instruments are available. So next day itself you don't get to see any marks on the beard, and that's the advantage. And a meticulous plan, like what kind of plan we are going to implement into the patient, because as we already discussed, the scalp hair has to go with the hairline as well as the crown area. Beard should not go in the front and the crown area. So we need to mix it, or else we need to implant a certain portion of the area with beard. Imagine if we are implanting only beard graft certain amount of the area, there is a demarcation between the scalp and the beard hair. That's the reason we need to mix it. That plan that goes with the patient needs. We need to understand patient hairstyle, how you're going to do it, where exactly you need to add the more density with the beard graft. All this to be done during the consultation and marking times. That's a very important point to be noted when you're talking about 2 consecutive days procedure. Most of the clinics does it, but they harvest all the graft from the scalp, which is not recommended, because there are two things we should understand when you're talking about the more number of grafts. Number one, how do you get this more number of the grafts? If you harvest beyond the donor limit, you end up in having a very depleted donor and spoiled donor in the back, number one. With that, kindly remember, you are not only spoiling and creating more baldness in the back, you are also damaging the skin, because by making near punches, by making near harvestation, you are damaging the skin more near. It becomes more fibrosis in the back, which definitely impossible to harvest next time. It spoils the texture of the skin backside. So we need to harvest the grafts within the safe donor limit. We cannot damage very nearby. We need to leave some space in between to skin to heal. Number one. Number two, imagine someone is giving 10,000 grafts. Imagine if you are densely packing it certain areas of the scalp, growth will not happen. Most of the people miss this point. If you implant more number of the grafts in a given square centimeter, I am sure it will not grow. There is an optimum number is given for each patient, because it depends on the skin laxity and blood supply depending on the area. We need to implant optimized number of the grafts to get maximum yield. Only certain amount of the grafts you need to implant to get best growth. Otherwise, we don't get growth. We simply implant it, it doesn't grow. It's just like planting the plants very nearby. There is a natural space we need to be given. Until then, these plants doesn't grow. Just like that, even hair also same. So this is the most important point to be understanding. That is the reason simply adding more number of grafts, like 8,000, 10,000 grafts, doesn't give you good density. As well as you're going to get a depleted donor in the back, you don't get any density. We are implanting certain amount of area where hair is growing better. Any gaps are there, next session we are going to fill it. With that, you don't compromise with the blood supply. You should not jeopardize the blood supply, otherwise you don't get good growth. That's as simple as that. The only threshold amount of grafts to be implanted in a certain given area. That's the most important point to be noted. So in this patient, we did this many grafts to achieve best density, whereas he also can undergo a second session after 6 months minimum gap. By then his scalp and his beard skin can be healed better. We can add more density throughout the scalp to get more enhanced camouflaging, more density, more good appearance.
Hello everyone. So I got my transplant here, 2 days, consecutive 2 days, and I think it was 5,000 grafts altogether. And when I came here, I immediately became comfortable with doctors, with the aura, with the way doctor explained about my plan, right? And whatever little concern I had, it was all explained nicely. The staff here is very supportive, very cooperative, very friendly, They take care of you like a baby, like, that much care. Nice lunch was provided, nice breakfast was provided, and every 10 minutes, 15 minutes, if you need a break, it is very easy, and you can ask for a break and go to washroom, or just sit there properly. The ambience here is awesome. Like, you don't feel like you are in a hospital kind of a setup or something like that. It is very friendly, very cozy. It feels like you are at home, or maximum at your office, if you like your office best. Once the anesthesia was given, there was no pain at all, and I was very comfortable during the whole process. I even got my beard graft extracted, and painless, almost painless. So I'm very happy, by the way, with everything.
Conclusion of doing 2 consecutive days is basically someone who has a time constraint that they cannot undergo second session after 6 months because someone is traveling or someone has a marriage nearby. So at least they want to add up some more density. Imagine only scalp, if you consider, probably you'll end up in 3,500, even 4,000 maximum. But 4,000, getting 4,000 grafts in all the patients, practically not possible. So usually we target 3 to 3,500 without damaging the backside donor. That means within the safe donor limit, we can only target this much. When if this is the situation, usually we can add the beard grafts. So if you can add the beard grafts next day, a combination of both scalp and beard, we can easily target almost 5,500 to 6,000 grafts. Whereas this patient, we did 5,392 grafts, and almost we covered it all the area. And depending on the scalp size, depending on the availability, we can also reach 6,000 grafts. So that greatly depends on the availability of the donor. Well, this patient had almost 5,392 grafts, covered all the area. But well, this person also can come back after 6 months for second session. We're going to harvest again from the scalp, maybe 2,500, 3,000 grafts, and get head full of hair. That means 2 sittings, 3 sessions. We can say 2 sittings, 3 sessions, you can get head full of hair. Even if you don't come back for 6 months later, you will have manageably good hair which covers front, mid, scalp, and crown. That is the idea of doing the 2 consecutive days. Well, this total discussion about each patient varies because each person's scalp size, scalp color, beard availability, chest grafts availability. Definitely, we need to examine and suggest him. So accordingly, we'll customize the plan for the patient needs and do it.